we are honored to have a couple guests from Moses Lake, from Health Source Chiropractic in Moses Lake, and they have some good news to share with us. But first, I would like to introduce them to you. We have Dr. Jones and we have Dr. Jeff Martin. Welcome.
Thanks for having us.
You are welcome. So our listeners are probably a little bit familiar with Dr. Jones, but Dr. Martin is a new face to us. So I would love if you would share with us a little bit of your background and how you became a chiropractor.
Sure. I was born and raised in Sunnyside, Washington, not too far away from here. And I went to college at Brigham Young University, got my degree in exercise science. Even at that point, I wasn't sure what I wanted to do. It took a while for me to get to the chiropractic route. I knew I wanted to help people in some way in healthcare. I just wasn't sure how. And so I shadowed a lot of people, a lot of different professions. And it wasn't until I shadowed a chiropractor that it really clicked with me. I really loved their approach. I loved just how well they helped people. And I found a school in Portland, so not too far away from Sunnyside, a chiropractic school. And so I applied, got in, went through it, and a few years later, here I am.
Sounds great. And I'm sure Dr. Jones is happy to have you on board as part of his team. So, Dr. Jones, would you share with us just a little bit about what chiropractic care is? Because a lot of times I think there's maybe not a full understanding of what it is.
Chiropractic care is all about getting the body to balance and to take care of itself. The primary focus is getting the nervous system functioning properly so that all the other interventions that you can do will also be more effective. This is done primarily through the chiropractic adjustment, releasing stress to the nerves, primarily as they exit the spine. At Health Source, we go a step further, though. We definitely work a lot with the physical rehab on top of that. We do a lot of physical retraining and neurologic training from a lot of maneuvers with basically exercises, although they're a bit more specific than that. We spend a great deal of time diagnosing people, not just from a simple standard disease state, but functionally figuring out if they can stand in certain positions, if they can perform certain maneuvers, which way the body moves, is it going in a proper pattern or not? That way we can retrain all of that. And what we find is as you get the stress off the body, it can handle it so much more, or life so much better, I should say. The current pandemic we're in is a great example right now. You know, everyone knows how terrible it is to contract COVID-19. Yet, if you're healthy, chances are you won't even have symptoms, which simply comes down to promoting proper health. And that is really, really what we focus on. It's not about the pain or the sickness or the disease. It's the lack of health that we really, really address and try to focus on. And it's the biggest challenge is, frankly, getting culturally people to respond to what they need to do. It's not a big magic bullet, and it's not a surprise when you can get actually people to understand what they've done to themselves over the past 30 or 40 years, and then getting them to reverse that behavior so that they can actually live healthily and get back to doing what they love.
Anything you'd like to add to that, Dr. Martin?
Oh, he put it so well. I'm not sure what I can add, but I'll try. You know, kind of along what Dr. Jones said, you know, one thing that really makes us unique here in Moses Lake is the rehab portion of what we do. You know, a lot of chiropractors out there, they offer the adjustment, which is great, but most of the time people need a lot more than that. And that's where our rehab really comes in because, you know, like Dr. Jones said, it helps us retrain our neurological system, you know, it helps us stabilize so these problems don't keep coming back again and again and again. You know, as much as we love seeing people, our ultimate goal is that we don't have to see them that often. So that's about my 2 cents.
Well, one thing, being a pharmacist that strikes me is that we're starting from an approach of helping the body heal itself along with a treatment and a plan. And so that's kind of exciting because we're not adding something to the body that's foreign. Because there is problems to that. But in the meantime, we kind of could talk about maybe even safety of chiropractic care. That's something I think that is maybe a misnomer out there. Maybe your industry hasn't been looked on too favorably, but maybe we should talk a little bit about what your thoughts are about the safety of your care.
There's quite a bit of misinformation about that, and I'm glad you brought that up. Here's the deal. I like to talk at it from a nuts and bolts situation, and let's just talk insurance. All healthcare practitioners have to have some level of malpractice insurance. And if you really want to find out what is safe and what is unsafe, talk to the people that actually have to pay out on these things. An average chiropractor pays less per year on malpractice insurance than your average medical doctor pays per month. We could just stop right there.
Right.
But so if you want to look for safety and you want some facts, that's the realest fact you can really look at. Are there some risks involved? Absolutely. It's impossible to intervene in the body without having some sort of reaction. The most common thing that you will see with chiropractic, you might be a little sore. That's frankly the most common thing. The one that everybody is always freaking out over is strokes. You went to a chiropractor, you had a stroke. And that's been going on long before I've been practicing, and the misconceptions that go on. Do people sometimes have a stroke after they see a chiropractor? Absolutely, it happens. But I think the best study I can point to is they did a retrospective study, and they looked at the number of strokes that happened 24 hours after seeing a chiropractor, and then they compared the incidence of strokes of people that had seen their medical doctor just for neck pain, for example. And what they found is there was almost an identical incidence of stroke after seeing a medical doctor as there was after seeing a chiropractor. In fact, statistically, it was just slightly higher. So if you went to see your medical doctor for, say, neck pain, and he didn't even touch you potentially, or mostly wrote you a script, and you had a stroke 24 hours later, that was slightly more frequent than seeing a chiropractor who actually might do a physical intervention to that neck. So the reality is, it looks like, while I'm not going to deny that there's absolutely no chance that a chiropractor was the final triggering factor to the stroke, but the reality is most times strokes that are involved with what they call a vasobasilar artery accident, if you want to call it that, basically a clot that gets thrown from the vertebral artery up into the brain, it is preceded by neck pain. That's a very common symptom. And so unfortunately, many times the practitioner gets the blame for it when it was frankly already happening. Yeah. And the sad thing is, it's impossible so far to be able to differentiate common neck pain from somebody who's having neck pain from a vertebral artery that is starting to dissect. It's unfortunate. I wish we could get past that. We're not there yet. But as far as putting that into perspective as well, your chances of dying from taking an aspirin is a few hundred times higher than your chances of dying after getting an adjustment to the neck.
Well, leading up to our interview today, I looked online just to see what an annual death looked like from prescription drugs. And these are drugs that were prescribed by a doctor. And this does not include opioids. This is about 128,000 people die every year from prescribed medication. And that might
study for as long as I've known.
Yeah, and that might be a little bit low because we don't always see everything being reported. So, prescription drug therapy does have risk factors. And so I would think getting a drug is a higher risk than going to a chiropractor at this point. And that's
the last time I looked at an epidemiological study, and again, stroke is the one that is always the thing. And by the way, most of these people don't die from these strokes. But the average is about 4 strokes per year. It's been a few years since I looked at the studies, but that was the last time I checked. So 4 potential strokes may be tied to an adjustment versus, as you said, definitely 120,000+ confirmed deaths from drugs.
Sure. So Dr. Martin, would you share with me and our guests who your typical patient is, and maybe surprises to us as to who they might be and who you can treat that we don't even think about?
Oh, that's a good question. The typical patient, There's a few typical patients I see throughout the day. One of the top patients I see is just your average blue collar worker, coming in after a long day of working and just feeling sore, just feeling very stiff, can't move very well. And, I'm glad I'm able to help them out. And that's one reason I love moving back to a town like this. Sunnyside's very similar to Moses Lake. And that's one thing I really look forward to, is helping such workers, people who are using their body day in and day out. And I just do what I can to help them moving and functioning better again. Let's see, some of the other types of typical patients that I see, are just, oh man, just everyone, everyone from all ages. I've been seeing a lot of, younger people in their 20s lately that are just feeling all sorts of aches and pains. And, one of the things I always tell them is, you are too young to feel this old. That is one of my favorite things to say to patients, because it's almost always true. And I just, like I said, do the best that I can, help them out, get them functioning better so they could feel more their age.
It's nothing more disheartening than to see a 10-year-old with debilitating migraines.
Exactly.
So what about pregnant women or infants? Do you see any clients like that?
Yes, I do. I have seen a few pregnant women and infants. For the most part, I see pregnant women, I could see them all throughout their pregnancy, but, and we definitely encourage them to come in just to help them out. I have 2 kids. And so I know from personal experience from my wife that, pregnancy could be pretty rough on the body for both the mother and the baby, honestly. And, and my wife, she had chiropractic adjustments throughout her second pregnancy, and she loved it. It really helped with her hips, with her back, and it really made that process a lot easier for her. Infants, I've seen a few infants, and the great thing about treating infants is there's a lot of different options we could take to help them out. It's not always using our hands, what we call manual adjusting. There's always different techniques, such as the activator, or what everyone else calls it, the clicker, which, like Dr. Jones says, a very light force technique where, it's not the aggressive form. I think that's why a lot of people are apprehensive about bringing their kids in, is because they expect us to just, put everything into
infants,
it.
The most common thing we see are colicky kids. That child that just can't seem to keep anything down, can't seem to sleep, can't seem to shut up, frankly. Colic has a phenomenal result with chiropractic. It's about 90+% of the time you can get it to, if not necessarily resolve, at least you can mitigate it and get the child quite comfortable. And sometimes that can be a big deal. Colic can be bad enough to where the child doesn't thrive. And so it's always nice to see them be able to eat, be able to sleep. And it's neat to see the sanity of the parents come back too.
Absolutely. As a mother of having one that was very colicky, that would have been a blessing. So good to hear. So ladies, just think of that when you have a baby that is suffering, that you may be able to get away from not using medication. It might be just an adjustment. And that being said, healthcare and pricing seems to be a big topic. And I know we didn't talk about this before, but kind of leads into alternative care always is thought of as being very expensive. And how would you like to address that, Dr. Jones, as far as affordability?
Okay, that's a great question. Am I allowed to talk about any specials we have right now?
Absolutely.
Okay. Health Source is a nationwide franchise, which allows us to not only stay on top of the cutting edge of treatment, it also helps us to figure out pricing and things like that. I've got to be careful how I say that. They don't tell us how to price things. That's against the law. But they do help us with the business side of things so that we can figure out ways to make things more affordable. Right now, we have a special for $29. We can do the full workup, x-rays, exam, what have you. So if you're worried about cost, the neatest thing is for $29, we can find out exactly what's going on with you. If we can help you, we'll show you exactly what would be ideal. And if there's any costs involved, we always go over that before you commit to anything. So maybe, and costs of course vary because of the severity of the problem that you have. So it might take a significant intervention. It might just be a very simple thing. We don't know. But for $29, you can find that out. As far as the other costs go, can it cost a little bit to take care of things? Sure. But you always have to factor in what it costs you to not take care of that problem. How much work are you missing? How much life are you missing out on? How much, frankly, life are you cutting you short on? You stress that body long enough, it cuts off the tail end of it. And it's not like you just don't live as long. You don't live as well. So you die 5 or 10 years earlier than you could have if you'd been able to take care of some things properly, and you're miserable for the last 15. What does that cost you? So you just kind of have to look at it from there. But we get that question quite often. And the best answer I can give people, well, it'll cost you about $29 to find out. and then you can go from there.
It's an investment in your health.
It really is.
Right. I know sometimes we don't put a price tag on that, but quality is important. I think standard of care does not equate quality. So great point that you brought up is, how do you want to live the rest of your life? Do you want to be in pain or discomfort or not enjoying the activities that your family or your friends are involved in?
I'm glad you phrased it like that, because that's one thing we really focus on. Is it's not just about pain. It's about how you live your life. That's why we ask all of our patients, what are some things in your life that this is affecting, and we use that as one of our goals, is to get them, a lot of times it's, playing with the kids, playing with the grandkids, going out golfing, or just work in general. And we use that as a goal. Like, okay, we're going to get you back to doing those things that you love. So
It's the why.
Yeah, it's always the why.
So I'm going to throw you under the bus a little bit, Dr. Martin, but I'm looking for a story. And
okay.
so share with me a success story that really hits home to you.
Oh, a success story. Let's see. A few months ago, we had a patient, 40-something-year-old male, working class, came in, could hardly even walk. He was literally limping into our office. And just, one of those things where the patient sits down with me and I think to myself, oh boy, this could be a real toughie. But, I worked with him, I was able to get a good plan going for him that included, the adjustment, rehab, some stuff he could do at home. And it was great, because it was just one of those textbook stories where every appointment at the end of it, he felt better. And every time, it only took a couple appointments where he wasn't limping anymore, but he still had that pain. A couple appointments after that, he didn't have any pain, but he still had stiffness in his low back, that is. And then finally, towards the end of the care, he just kept coming in. He's just like, I feel great. No pain, no stiffness, nothing.
Mm-hmm.
And it was just one of those great things where, at first, he had to call into work. He couldn't work anymore. He couldn't do anything. He couldn't go out and have fun. And by the end of care, he was able to do everything he wanted to do. He was able to work, no problem. He was able to walk without a limp, like 41 or whatever he was, that's not something anyone should have to do. And it was great. I could just see not only the physical aspects, but also the emotional, mental aspects of it, where he was just so down on his luck when he first came in. And by the end, he was just this chipper, happy dude that we were always glad to see by the end of it. And it was great.
That is a great story. I love hearing that, because it changed his life and his family's life by taking care of a problem in an alternative method that really should be more standard of care, I think, in our country. So I'm going to throw Dr. Jones under the bus with the same kind of scenario, perhaps, or something different. What stands out in your mind as somebody that had improvement with your therapy?
Oh, there's so many. It's a little hard to choose, but there's one that's dear to me. 24-year-old young lady came to see me, debilitating migraines. She had started having headaches when she was a junior in high school, kind of got through high school simply by giving up everything. She had no friends, gave up all of the extracurricular activities she liked to do, just so she could finish her studies. And then, she left home after that. She went to college, at least she tried to. She got through a semester and a half of college, and she was failing. She ended up dropping out because she couldn't concentrate. She couldn't get her work done. She tried to get jobs 2 or 3 different times, ended up either getting fired or quitting because she just couldn't show up to work on a regular basis because she never knew when these migraines were going to hit. Poor girl had ended up moving back in with her parents, and she had no prospects, had no life, had given up on every one of her goals. Her migraines were coming at least 4 times a week, and when they hit, the day was over. If she tried to do anything, it would end up making her throw up and everything. She had lost around 30 pounds, and she was never overweight to start with. So we started working with her, and mind you, it took a little bit of work. It was about a 3-month ordeal that we went through. But after the first 2 weeks, migraines were down to once a week.
Wow.
From there, wow, excuse me, this one still touches me. But from there, we were able to get these migraines under control. It's been 3 years. I was talking to her just 2 weeks ago. She now has a career. She finished her college degree. She still is a little bit shy, hasn't been out dating or anything, but she's got a dog, and she's about ready to move out of home. It's not because of finances. She just, like I said, she still has a shyness issue going on that she wants to overcome before she goes out on her own, but she's got her life back. There's one other story that I'd like to tell. This one's a little shorter. And this one, it was actually a family member. I had an aunt call me up, my mother's sister. And I'm not even sure why she called me out of the blue, but as we were talking, and she lives clear down in St. George, Utah. I was asking her how she was doing, and she confessed she was having trouble walking. Her back had gotten so bad. She'd had 2 surgeries in the past. And she just, she's in her 80s and wasn't performing well. And I offered to have her come up, and we've had a few of our kids leave home, and we had some space, and offered to have my aunt come live with us for a few months. And we brought her in to a full evaluation. Like we talked about, we looked at that functional issue. It wasn't about her pain. It's what can she do or not do. And we worked on restoring all that through exercises. We also put her through specialized traction, which is designed to basically pump the disc up, give a little more space in there. And within just a couple of months, we had her she couldn't walk from my front door to the bedroom without having to sit down when she came to stay with us. By the time she left, she was walking 2 miles straight a day. And she has continued to do that for the last 4 years. She's got her life back. And I, frankly, I had to scare her a little bit because part of her problem was some of her habits she had. She liked to sit down all day, and she was using the pain as a bit of an excuse, and it had gotten her trapped. But I made it real clear to her, says, you can either do what we're talking about here, or you'll be in a rest home in the next 6 months. And I don't expect you to make it 3 years. That's just where she was. And, that one definitely wasn't about the money at all. It was about taking care of family. And it was, you're putting your reputation at risk when you're trying to help a family member. And it was just a wonderful thing to do. And mind you, we've seen results like that many, many times in our clinic. But that was one that still sticks with me because I was sticking my neck out when I did it.
That's amazing. I love all your stories. I think one thing that resonates really strongly to me is that once that person has their function back, their whole life has taken a new direction in a positive way. And that didn't take a drug or surgery.
No.
I'm not saying that those things aren't important sometimes and they don't need to happen. Our son broke his leg and he needed to have that surgically fixed, and we understand that, but there are downsides to having the surgery and a downside to taking medication as well. So love hearing that. So one thing that I want our listeners to know about is Health Source of Chiropractic of Moses Lake has a new facility. And so I think they are super excited to share about their facility. So whichever one wants to jump in, Dr. Jones or Martin, go
Doc, why don't you tell them about tomorrow?
Yeah. So tomorrow we actually have our ribbon cutting for our new building. It is, my wife, was it 12:30? Yeah. My wife texted me to remind me. Yeah, 12:30 to 1:30 tomorrow. Tuesday, we have a ribbon cutting at our new building. And, we're really excited for it. a lot of the space we devoted for it is for our rehab center, because that is one of the most important things that we do, is that rehab, those exercises that we teach. So there's a lot of room for that. And also, we left enough room for expansion. We keep seeing more and more patients every day, and eventually we're going to need to bring in another doc. And so we left some room for that doc as well. And, you know, just so much room, so much more daylight coming in through the windows.
And we were very fortunate when we built this. We were expecting to expand and needing space. We were not anticipating a pandemic where we needed social distancing. So now the nice thing is we've got enough space. We can pretty much see as many people as we want to and still have more than 6 feet between them. And it's a great place. And it's set up the way we've been wanting to do it for a long time. So we're excited about that. And of course, everybody's welcome to the ribbon cutting. We're not calling it a grand opening because that's going to be too many people. We don't want Governor Inslee there, but we'll do probably a grand opening next spring would be my guess.
Yeah.
That's super exciting. And I love what you're doing with the rehab, because just a little story with our son, Jordan, when he broke his leg, he started in moving right away. And I think that's one thing that I love to hear with what Dr. Jones and Dr. Martin is talking about, is being in motion is part of being healthy. And the story of helping his aunt, it's true. Sometimes we have to sit people down and say, you have to move to get better. But moving correctly is probably more important than just moving, because I'm sure the gentleman that was working, that Dr. Martin helped, was probably doing some repetitive motions at work that wasn't very helpful as well. So,
and a lot of involuntary motions.
Yep.
A lot of us don't know we're standing wrong, we're moving wrong, we're wearing things out just with normal activity. Not good.
Normal activity, or maybe shoes, or
Yes,
we deal with feet a lot.
Lot of feet problem. Even when you don't feel pain in the feet, a lot of the source of problems can come from the feet.
I would say close to 1/3, or 3 out of 4 patients that come in, they have a foot issue that has to be addressed, and they don't even know it.
so it could be improper soles, just the wrong shoe.
Yeah, and the mere fact that God really did not design us to be walking on concrete and flat surfaces from birth. And it has a tendency to break things, normal structures down, and we have to figure out ways to compensate for that. And it's actually fairly straightforward to do. But first, you got to identify the problem.
That's good to hear. Yeah. So what about nutrition? Shawn and I talk a lot about nutrition, and I have a sneaky feeling that slips into your care as well. Not that you guys
You want
are.
to talk about that at all, Doc?
I'll talk about some nutrition. Yes, we are very big on nutrition. There are a lot of products that we use and provide for our patients that could really benefit them. We have our core nutritionals that are all about reducing that inflammation in the body. One thing we don't want patients to rely on are, NSAIDs. I have a lot of patients that are like, I had one this morning that said, I've been taking Advil constantly for the past 4 days. And that's not stuff I want to hear. So of course, I want to treat them, get out of pain, but also provide those all natural nutritionals, that'll also help bring down that inflammation and pain. You have your omega-3s, your probiotics, all that stuff that could help them. And of course, we have other products that, could help with more, I'm blanking on the word, but more specific, that's the word, more specific problems, whether it's a disc issue, joint issue, just stuff that could really target their specific need. And so long story short, yes, we are very big on nutritionals.
Yeah, the American diet, just to start with that, it's highly inflammatory to start with. So
agree.
well, you're already inflamed with the food that you eat, and then you start doing abnormal activities and add a little stress to that. Sure, it doesn't take much at all to push you right through the roof. And if we can at least offset the dietary side of that, then the physical side is much, much easier to deal with.
So, and Shawn and I have talked to our listeners about this, that during this pandemic, the inflammation is probably not your friend.
No.
So if we can do anything besides moving and get your inflammation down, those are things that you have control over. So I'm all for that. And like Dr. Jones said, the American diet is so off the chart, not healthy. So, anything we can do to adjust that and put it in a better perspective, I think is wonderful to hear. So I have a question about what the rehab looks like, and I'm sure there's many, many different scenarios out there, but I'm assuming that some of the work isn't just going to be in your office. It's going to be also at the client's home.
The ultimate goal
Yep.
is to move the therapy to the home. But as I've been pointing out, and Dr. Martin will back me up on this, people, they do things poorly. We used to get this question all the time. I rarely get it anymore because patients get it a lot faster. You know, they say, well, can't I just do this at home? I said, no, because you suck at it. You know, you've got to do this right. Otherwise, you're going to create a problem. That's why Health Source is very big on what we call our Health Source motion screen or movement screen. Is it 9 different motions or 10? They're always adding a few. 8 right now, 8, 9. Specific motions that aren't so much, you know, the global things that you would expect. They're small maneuvers, you know, like can you touch your fingertips from back to side, and can you do it the same from side to side? It'll tell you where things are tight, where they're loose, where they move improperly. Yeah, I can see the people over here.
Shawn needs some help over there.
Shawn needs some help.
Okay. Yes.
So basically that's a combination of a physical adaptation that's incorrect and an anomaly in the nervous system, which is causing things to move improperly. And we tailor the rehab specifically to the motion patterns or these movement screens that each patient comes in with. And then we move them up. And as they graduate through this, certain maneuvers they start to master. Well, those go home. We're not going to waste time at the office anymore. We're going to start doing something more complex. And that's where the real magic happens. When we can get somebody to open their eyes and realize that this was bad and it's now improving and that they can control it. That is a neat thing. And then it comes down to, once we get that under control, do we talk wellness? Sure. You know, we coach people over time. We work with them and we have to offset some things that they cannot do on their own. And, you know, that might entail a regular tune-up depending upon the type of work they do, the activities that they do on the site, and also, frankly, how much damage that they incurred long before they ever got this under control. That's a factor that we have to take into account.
That's a great point. So I know my husband is a fan of you folks, and just to speak,
Yeah, we love Shawn.
Just to speak to the athletes out there that are training, you might want to think about that too. Do you see other athletes besides my husband come in for just an adjustment?
All the time. And if you're talking athletes, you will never see a pro sport that does not have a chiropractor on the field. It just it reduces injury and it increases performance, just flat out. And it's a neat thing to work with. And you know, injuries still happen on occasion with sports, but those that are under chiropractic care, they frankly, they heal faster. Can I pull out studies on that? No, because there's no money behind finding that kind of stuff out. There's no multi-billion-dollar industry, but you don't need studies when you look at the pro teams. There's not somebody there with a needle on the field. There's a chiropractor on a table.
That's good to hear. I imagine college is moving in the same direction as well. So,
oh yeah, they have for a long time.
Yeah. So do you see any of our high school athletes come through your office?
Yeah, sure.
Yeah,
maybe not this year, but...
maybe not so much this year right now. I see, you know, all sorts of athletes, high school athletes. I see people who are, you know, dancing in some dancing troops. I see people that are playing hockey, you know, all sorts of ages, you know, middle school, high school, that, you know, they play their sports, they get a little roughed up, they get, you know, a little tight in some regions, and I help them getting functioning more properly, you know, because the last thing you want is someone doing a repetitive task improperly. That's where a lot of that wear and tear happens. And we definitely don't want it to happen at such a young age,
throwing their shoulders out and all that other stuff when it had nothing to do with power or anything. Their technique was off, not even from training in the coaching. Their muscles fire in the wrong order. That has to be retrained.
Mm-hmm.
It's true. And, you know, I think about what we do in sports now is we've kind of done all year with the same sport versus multiple sports throughout the year. So that proper technique or motion or getting you back into a proper function when you're doing your exercise is probably very, very important, especially if it's only one sport. Any opinions about the one sport athlete?
Well, I think you kind of pointed it out. Anybody that does just one thing all the time, no matter how perfectly they do it, that is not balance. But at the same time, I understand if somebody really loves something,
Mhm.
I don't really want them to quit. Let's figure out how we can work around this and at least maximize the body in a way that reduces the injury as low as possible, and let's at least eliminate the activities that are definitely detrimental, and they don't even know they're doing that. So, and while it's easy to criticize an athlete because they overdo it, let's face it, they're not dying of a bunch of the other stuff that everybody else is. So it's still a healthier thing to do. Not to pick on a sport, but the only activity I really don't enjoy or don't like my patients doing is, the long-term running. I have yet to see a runner that doesn't blow something out. It's going to happen. But at the same time, if running is what they love, well, the last thing I want to do is have them switch over to something they don't enjoy, and then they'll quit doing. And yeah, then they're going to really miss out on life. I'd rather have them blow out that knee eventually. But if we can look at their feet, make sure the mechanics are proper there, and get the muscles balanced through the hips and the mechanical chain all the way up, so that they reduce the stress off there, maybe they'll last long enough to where they find something else that they enjoy, and maybe they won't blow that knee out.
That's a great point. Great point. So, anything laying on your heart, Dr. Martin, that you'd like to share with our clients today? Because I heard you might have to step out a little bit early.
Yeah, I have a few more minutes here. Just that we're here to help as many people as we can. That's why I love being here, working for Health Source and doing what I do, is because I love seeing people getting back to doing what they love. There's a lot of different ways we could do things. And, one thing I tell all my patients is we appreciate feedback. We really listen to our patients. I hear too many stories from from patients seeing other professionals where they don't really listen, or they say, my knee hurts. Like, okay, well then let me look at your neck, or, stuff like that. When, I like to think, we really listen. We really want to help you get better, live a better life, and we will do whatever it takes to get you to that point.
That's nice to hear, because traditionally I'm hearing from my clients that they only get maybe a few minutes with their provider and they're checking the box. And my guess, Dr. Jones, is when you have a client come in that you're taking some time with them and going over things.
Well, definitely, and that's why we have a team, especially somebody that's in active care. During active care, it's very common for them to be there an hour or more. Now, they may only have 5 minutes face-to-face time with me, but it's a very concentrated time, and it is in a dovetail relationship with the therapy people that we have there that are working through things. And of course, the communication that's going on during that hour, they can always pull me back in, which that does happen. And we make sure that their key values, the things that they love to do, is really what's being addressed that day. And I've always found it interesting when you get to know the patient, how every once in a while it'll click with them that, gee, I really didn't see you for very long, but I felt like we had a really long conversation. And that's because everything that they're saying and doing is shared by everyone that's there in the office. So that's why we're able to stay so focused and yet still see so many people.
I love hearing that, because that is one of the major concerns that patients have right now in the United States, is they're not being heard. And this is a great way to address issues on a safe level with long-term effects. Because I imagine the gentleman that Dr. Martin was talking about could have easily went in, could have easily been told he needed to take some pain meds or sleeping meds, or maybe set up for surgery, and none of those things happened, I'm guessing.
That's exactly correct. And I'm glad I was able to provide him with that option instead of, him having to get surgery, which would have had its own, possibly severe side effects.
With an 80% chance of never going back to his job.
Yeah. And so that's why one of the biggest reasons I chose this profession is because, I've had surgery in the past. It was for a torn ACL, so that kind of had to happen, but still, I want to be that other option. A lot of people are too afraid to get surgery, and so they just live in pain for the rest of their life. And so I want to be there for those people that, there is another way. long story short.
That's awesome. I think you're right. I think people get stuck in the fear mode and don't really know there's other tools or options for them out there. And so I'm glad we can do that for them. And also when Dr. Jones talked about a young lady, in her life just starting out, I mean, that's a game change for her, because now she can live her life and pursue a career and a life to live. So
Yeah.
that's wonderful. And I'm assuming if we went down the traditional route, we would be on all kinds of medications and drugs and shots.
And she
Maybe.
had been on that route. It was destroying her. And she was already starting to have indications on her blood test that it was damaging her liver. And it was a terrible thing she was going through. She's drug-free, pain-free, basically problem-free at this point. Now she's dealing with the things that a woman in her mid-20s would deal with, and consider those problems. Before, she couldn't even imagine dealing with those problems. They just didn't exist because she was not going to go forward with her life.
Right.
She was already dead.
Right, which is really sad because, we're talking about two individuals that are fairly young that had some really debilitating things in front of them that were solved solved in a way that, put them on a path, and a successful path with their family and a future. So that's wonderful. So when we talk about your facility, Dr. Jones and Dr. Martin, what can it look like when you go in with this pandemic?
Well, of course, we are wiping down everything between every patient because we have to consider that they're all diseased and infested and all that other stuff. But we treat them nicer than that.
Okay.
We've got the hand sanitation stations, and like I said, fortunately, we have lots of space now, so social distancing is not an issue. As mandated by the state, we're wearing masks. So you can have your own opinions as to whether that's necessary or not, but we're doing it. From a pandemic standpoint, I think that's the best I can say. The other neat thing is, this is not like going to your standard medical clinic where you sit down, you look across the waiting room, and everybody looks sick. And even before the pandemic, you were always afraid of catching something. We deal with, from a medical standpoint, healthy people. They may need to lose 40 pounds, or they might have some physical issues going on here. But these are people that are seeking to become healthy. They are not looking for a way to get away from their symptoms. They're not looking for an excuse to not start moving around and doing those healthy choices that they've got to do. We have the curse and the great blessing of the only way a patient can get well under our care is if they have done an effective change in their life that positively makes the body function the way it's supposed to. We can't cover up any problem that they've got. So if they look better, they're better.
That's a good point. And the reason I bring this up is because I think there's a lot of people sitting out there listening that maybe they're afraid to go in and see a provider. And I know our dentist was talking about that when we interviewed him. And I think we need to get past fear and get moving. That's the only successful way that we can go forward now. And I'm glad to hear that you're able to do that. And that's a wonderful point that, if you go to a chiropractor, your odds are that you're going to see a healthier individual than if you are going to a clinic where sick people are because they're sick. We're preventing, we're also in the atmosphere of patients that are already taking care of themselves. The clients there already have a different level of health. So don't let this pandemic be something that stands in the way of receiving the care that you need, and being fearful for not going inside. Because really, honestly, from what I've read, it's not the facility and the contact of the equipment that's going to cause transfer. It's going to be the exposure to somebody who's already sick at close distances. So
yeah.
Dr. Martin, it was a pleasure to meet
Yes.
you.
Thank you so much for having me. I do have to head out. Work calls.
Go get him, Doc.
Will do.
So I want to end on some personal notes here, Dr. Jones. When we had you on our radio show, I believe you had a new addition to the family. So we would love you to.
Well, which edition? I can't remember how long ago that radio show was. It's been at least a year. Has it been 2?
No.
Not sure. Well, since that time, it's very, if it was a single edition, then we're probably talking about my first granddaughter, Margot. She is almost 2. She's driving her mother mad, which is great. I love it. And since then, daughter number 3 has gotten married. So that's son-in-law number 3 that we have. And we've had a second grandchild from our daughter number 2, Serena, and she's just beautiful and laughs and her favorite thing to do is to watch her mom do the laundry. She laughs every time her mom will pull something out of the washing machine, which I have no idea why, but she thinks it's just hilarious. So we get a lot of Zoom calls and video calls with that, and which is a great thing. So those are the additions that we've had.
That's good to hear. I think we had to reschedule because of one of the births, and that was such a good reason. We were so happy to hear that for your family. So congratulations on that.
Thank you.
So do you have, besides Dr. Martin, do you have any additional people that you've added to your staff since?
We have 5 team members that work with us, 2 full-time therapy people, 2 front desk as well. That then sometimes they work with the therapy as well, just a little bit if we're running over. And I've got another 2 part-time people that really save all the headaches in the front with the billing and the things, and just staying on top of all the insurance issues so that patients don't have the headaches and we don't have them either. One of my therapy people is a licensed massage therapist. We're not doing much massage right now because, again, of the fear factor that's out there. But she is uniquely qualified to help us in the therapy bay. She can see muscle patterns far better than the average person off the street. So that's kind of the team there. And of course, like I said, Health Source is a nationwide franchise. So we are constantly in contact with other clinics and learning new things. We spent last week about so it was close to 20 hours of training that we did on a Zoom call. The pandemic has created an opportunity for us. Health Source has what they call Health Source University. It's required for all new clinics that join. We go in and they train in all the systems, and a lot of it is the diagnostic and the treatment patterns and things to look for and ways that we can serve our patients that really we weren't taught in school. And with the pandemic going on, they did it virtually last week. So we shut the office down. So we were running on East Coast time. We were in class from 7 till 3, Monday through Thursday last week, and really covered a mountain of things. And it was neat to see how well we're doing in some areas and what nuggets we could pull out and start implementing. So we've been doing a lot of that. And every week, every Tuesday, we train. We spend 3 hours and we just really hit it, looking at ways to diagnose, treat, and even simpler things. Well, not simpler things, things that do matter to the patient, the coding and all that other stuff that can create a real nightmare for the patient if it's not done properly. So we work on those every Tuesday, and during that, there's usually a half-hour virtual meeting that we're holding with 20 other offices frankly, from all of the Western United States. And so that's what we do. It's we train and we serve.
That's super exciting. So Dr. Jones, I don't think we told the patients where your new office is located.
Oh, yeah.
Like, get a hold of you. So if you would share that.
We are at 411 East 5th Avenue. We are right across the street from the public library, sandwiched between Rite Aid and Granco Bank. And
Wonderful.
Plenty of parking, and it's just, it's neat. We've resolved all the issues we had with the other building.
Super exciting, because I think parking was one of the things that was a little bit difficult for you folks. And I think that
it was hard to look an 80-year-old patient in the eye that was having trouble walking, and she'd have to park a block away and cross the street. It's not what you want to do.
No, but super excited for you. We are so thankful you could make it on our show again. Dr. Martin seems like a great fit to your...
He's phenomenal. I wouldn't have him if he wasn't just superb.
That's good to hear. Well, you're listening to Health Solutions with Shawn and Janet Needham, and our producer, Lindsay. Thank you. We're excited to have some new guests coming our way, so keep looking on our Facebook for those announcements. And thank you again for watching us. We look forward to talking to you soon.